You know, if you have someone that requires home health services, you want to be sure that you hire someone or you work with a service that's very dependable, has reliable employees, and not this contracted thing out there, the people that work with them. Well, today on the show we have from Praetorian Health Services, we have Jessica Leahy and a newcomer, Vivian Champagne. Welcome to the show.
Thank you.
And if you would, starting off, Jessica, tell us a little bit about Praetorian.
Well, Praetorian Health Services is a private duty in-home and supplemental staffing agency. We offer CNAs, companions, RNs, LPNs to individuals who have disabilities and seniors who want to stay home. We also offer staff to hospitals, facilities, and doctor's offices who could be PRN or come in and assist and take over whenever employees are out on sick leave or they need to be out for maternity leave or things like that.
Now, I mentioned that you have your employees are not contracted out. They actually work for Praetorian, correct?
Absolutely. All of our employees are our employees. They're not independent contractors. And what that means is that we do carry workers' comp insurance, liability insurance on them. So whenever they come into your home, they've had national background checks, they've had drug screenings, they've had TB testing, CPR certification, first aid, a full gambit of orientation as far as training, personal care training, things like that before they even come into your home. So we know thoroughly what they can do before we offer their services to you. Because,
I mean, what they do reflects basically on Praetorian themselves.
Absolutely.
Now, let's talk about some of the services that you provide. I know we have a lot of people that come down here to retire, a lot of people who have lived here all their lives, and they want to stay here, but they love staying in the comfort of their home. And that's something that's very important to Praetorian, right?
That's very important. And people do want to stay in their home as long as they can, and that's what we can help them do. We can take them out for their hairdresser appointment. They want to go to the Red Hats Ladies Luncheon or to the senior center, then our caregiver can take them out safely to do that. Or they can stay in the home with them overnight. If the family is uncomfortable leaving their loved one alone, then our caregivers can keep everyone posted on what's going on, and we can take care of them that way.
And that's one good thing about whenever you have a caregiver that works with a family, they're going to come in and I'm sure going to have basically a little interview section, get to know them, and so that way they'll feel comfortable with them, right?
Right. Well, we come out and we do a free consultation because all of our services that we offer are very personal. We want to make them as personal and unique to each home as each individual is. So when we come out and we sit down with the family and we interview them, we ask not just about what they need medically, but also what are their hobbies, what are their interests, what do they like to do, what shows do they like to watch on TV, what kind of crafts do they like to make, or do they like to play bridge or cards, or anything else that is a part of their history and who they are, to help get a full kaleidoscope of care for them, not just medical, but also spiritual and emotional as well.
And how important is that, the personal approach to that, to work with each individual one? How important is that in their recovery?
Well, health-wise and recovery-wise, love and compassion goes a long ways. It's important that it's a good match. I mean, it's like having a roommate. You don't want just anyone in your home. You want a good match there. We've both been in the healthcare field a long time. We realize how important a lot of these factors are, and we work with other agencies, the home health, the hospice, to make sure that the client has all the services that they need.
Now, you mentioned something earlier, the fact that, yes, you go to homes, but you said you also go to hospitals or senior homes, correct?
Correct. Hospitals, nursing homes, assisted living facilities, and we offer staff as PRN or a long-term solution. We do short-term and long-term contracts. It just depends on what the staffing needs. If their census is up, we make sure that their employees' credentials are on par with what the facility or the doctor's office needs, JCO standards, things of that nature. And then we make sure that all of their credentials are up to date before we send them over, and we also put them through their background training as well. And once we get them on par with whatever the facility needs, then we send them out to be a contracted staff worker with them.
Now, do you have, I'm sorry, go ahead. You started
as an example, when my mom, if she has to go in the hospital, one of us always stays with her at night just to make sure her needs are met. You know, if it's a long hospital stay or if the loved one's out of town, then you can hire one of our caregivers to sit there to make sure your mom or your dad's needs are met in the hospital. Because, you know, although the nurses do the best they can, you know, everybody's staff is short.
Well, this is true, and being able to work one-on-one, and that's one of the great things about your employees at Praetorian is because you do such a thorough background check, the interview process and everything, and I'm sure there are different areas in which they have their own expertise, whether it's physical therapy, a registered nurse, you know, or anything along that line.
Well, Alzheimer's and dementia is an onset and widespread epidemic that is taking over these days. So we make sure that we very thoroughly and keep everybody up to date on the training and the latest techniques of how to redirect individuals who have these things, how to help them live the best life that they can and have the highest quality of life that they can in their home and being in their home setting with the memories and the legacy that they've built around them really helps them with their quality of life.
And also, whenever you're working with someone at their home, there's other things that you work with as far as bathing, personal items, or even doing simple things like if they're in a recovery mode, getting back to doing things that they used to do, cooking, cleaning, whatever, making life a lot easier for them.
And we keep that refrigerator clean. That's important that they're not eating food that's been sitting there for a while. So that's one of our services that we help them with.
Nutrition.
Yes.
You know, I know you have nutritionists that work with them as well.
Good nutrition, taking their medications, following the care plan or the doctor's orders after they've been discharged from a facility so that they're not readmitted to a facility. Those are all things that we can help families with and also, you know, in the end, help facilities and physicians with as well. We are also going to be facilitators of an Alzheimer's caregiver group at our office, so we can help, you know, with education for the community in that aspect as well.
And the great thing about that is, you know, the thing with Praetorian as well, you have a lot of the caregivers that are actually there right now are family members. And, you know, whether it's a brother, sister, daughter, son type thing, granddaughter, grandson, and this helps give them a break as well. Because whether they have jobs, they have other obligations, or they just want, you know, maybe get a weekend away.
Yes.
Because it's not something that you have to do full time.
Sometimes we lose the caregiver before we lose the patient. It's
Wow.
so hard on them.
Thank y'all so much for being here
Thank
today
you.
and give us
Thank
some
you for
information
having us.
with Praetorian. If you'd like some more information, there's a website on your screen. You can go to their Facebook page if you'd like to make an appointment for a free consultation. They'd be happy to come out and talk to you about it. Phone number is on your screen as well. So give them a call. If you need someone to be taken care of in your home, give Praetorian a call.